somebody with social anxiety disorder has a higher likelihood of developing things like major depression. Their anxiety is really excessive in proportion to the situation. Hi, this is Jim Brillon. Welcome to this YouTube channel where we talk about all things mental health. Today I'm going to be talking about social anxiety disorder. Hopefully it can help to explain what it is specifically and how it can be treated. Social anxiety disorder it's not just anxiety. It's not just being shy or quiet or introverted. Social anxiety disorder can be a really debilitating disorder and really impact people's life and functioning. It's estimated that about 12% of the population actually has social anxiety disorder, and social anxiety in general is a very prevalent issue. Like I say, it's not introversion, which is a personality trait. It's not shyness, although shyness in childhood can be a potential precursor to developing social anxiety. People with social anxiety disorder have a really intense fear of being criticized, of being scrutinized, of being judged by other people, and it can be to the point that it's really debilitating for them. So there are some risk factors, including biological risk factors can be being born with a specific temperament that makes you more vulnerable to anxiety, and also growing up in an environment where maybe you have some difficult or unpleasant experiences in childhood, specifically shaming experiences. It tends to happen more often with females, and what happens is that people develop a personality that focuses really intensely, hyper-focuses on negative evaluation by other people, and then they start to negatively evaluate themselves. A couple of risk factors as far as parenting is that there's some evidence that an overprotective or a hypercritical parent can actually help to develop this disorder. And then it just gets worse if you really listen to the ruminations, the obsessive thinking about, I'm weird, something wrong with me. And somebody with social anxiety disorder has a higher likelihood of developing things like major depression or even substance abuse issues as a way of numbing their anxiety. As far as diagnosing it, there are criteria that the DSM list. And first we want to rule out that there's any kind of medical cause for the symptoms or medications. But the criteria are that a person has a persistent and intense fear of anxiety, specifically about social situations, because they fear they're going to be judged, they're going to be embarrassed or humiliated. Then they tend to avoid those anxiety-provoking social situations, or if they go through them, they do it with intense fear and anxiety. That avoidance is actually another trigger that makes it worse, because the things that we're anxious about we avoid, and the more we avoid them, the more anxious we get about them. Their anxiety is really excessive in proportion to the situation, and it really starts to interfere with their daily living. This is the part where you see how it really impacts their academic performance, because they're less likely to interact with peers or with teachers or professors, and it can really impact their career development as well. People with this disorder tend to avoid new situations, new people, and they sometimes avoid their peers because they're fearing this negative evaluation. So they're actually less likely to get married, and they're unfortunately more likely to have things like suicidal ideation and even attempts. There are some hypotheses about how this develops, including reduced serotonin or highly activated limbic system, the fight-flight system. Treatment involves psychotherapy, specifically cognitive behavioral therapy, and the combination of CBT and medications can be really, really effective. There are a couple of types of social anxiety disorder. People that their anxiety is more in the public, and when they're performing, like doing a presentation or something like that, are generally treated with things like benzodiazepines or even beta blocker medications. And people whose social anxiety is more in everyday situation, SSRIs or antidepressant medication can be really helpful. So As far as coping with it, you want to give time for treatment to work, and you want to see if you can try to push yourself outside of your comfort zone little by little. Going to lunch with a friend who makes you feel safe, and then trying to, speak to a waiter or talk to people, initiate conversations. One thing that you can think about as far as managing social anxiety is slowing down your breathing, because when you're anxious you get really rapid and shallow in your breathing. So if you slow down your breathing and also challenge some of those thoughts that run through your head about people are judging me, and then staying in a situation and not leaving, not avoiding it. A big part of it is really challenging those ruminations and not feeding into them, and not allowing yourself to believe that there's something wrong with me, or I'm weird, or I can't get better. So there is actually a lot of hope for coping with social anxiety disorder. Hope the video is helpful. If so, please like and subscribe, sign up for notifications, and put things in the comments about what you think, or if you have questions or anything else that you'd like to hear me talk about. And I'll look forward to sharing more with you later. Take care.